Welcome back to Drugs Decode. Sulfonylureas, we're going to test your knowledge with a fun quiz. Let's go. Question 1. What is the primary mechanism of action of sulfonylureas? The correct answer is B, stimulating insulin secretion from pancreatic beta cells. Sulfonylureas bind to the sulfonylurea receptor, SUR1, on beta cells, causing an increase in insulin release, increasing glucose absorption in the intestine. This is not the mechanism of sulfonylureas, but may describe glucose transporters. Decreasing hepatic glucose production. This mechanism is associated with metformin. Improving insulin sensitivity in peripheral tissues. This is the action of thiazolidinedione, not sulfonylureas. Question 2. Which of the following is a first-generation sulfonylurea? The answer is B, tolbutamide. Tolbutamide is a first-generation sulfonylurea, characterized by a shorter duration of action and higher risk of side effects. A. Glympyride. This is a third-generation sulfonylurea. C. Glyburide, a second-generation sulfonylurea. D. Glipizide, also a second-generation sulfonylurea. Question 3. What is the primary adverse effect of sulfonylureas? The correct answer is A. Hypoglycemia. Sulfonylureas increase insulin secretion, which can sometimes lead to low blood sugar levels, especially if meals are skipped. Weight loss. Sulfonylureas often cause weight gain, not loss. Lactic acidosis. This is a rare but serious side effect of metformin, not sulfonylureas. Hepatotoxicity. While rare, sulfonylureas can sometimes affect the liver, but hypoglycemia is far more common. Question 4. Which sulfonylurea is preferred for elderly patients due to its lower risk of hypoglycemia? The answer is A. Glipizide. Glipizide has a shorter half-life and lower risk of prolonged hypoglycemia, making it safer for elderly patients. Glyburide has a higher risk of hypoglycemia due to its longer duration of action. Chlorpropamide, a first-generation sulfonylurea with a long half-life, increasing the risk of hypoglycemia. Tolbutamide, also associated with a higher risk of hypoglycemia in elderly patients. Question 5. What is the primary reason sulfonylureas are contraindicated in type 1 diabetes? The correct answer is B. They require functioning beta cells to work. Sulfonylureas stimulate insulin secretion, which isn't possible in type 1 diabetes due to the destruction of beta cells. They cause severe hypoglycemia. While hypoglycemia is a risk, the lack of beta cells is the primary issue in type 1 diabetes. They increase insulin resistance. Sulfonylureas don't directly cause insulin resistance. They are toxic to pancreatic beta cells. This is not true. They stimulate beta cells rather than harm them. Question 6. What is the recommended time to take sulfonylureas for optimal effect? The correct answer is A. Before meals. Sulfonylureas work best when taken before meals to stimulate insulin release in anticipation of rising blood glucose levels. After meals, this timing may reduce their effectiveness. At bedtime, not recommended as it may increase the risk of nocturnal hypoglycemia. Early morning on an empty stomach. This may cause hypoglycemia without meal intake. Question 7. Which sulfonylurea has the longest duration of action? The correct answer is A. Chlorpropamide. This first-generation sulfonylurea has a very long duration of action, which increases the risk of prolonged hypoglycemia. Glympyride has a shorter duration compared to chlorpropamide. Tolbutamide has the shortest duration among first-generation sulfonylureas. Glipizide, intermediate duration of action. Question 8. Which sulfonylurea is best avoided in patients with kidney disease? The correct answer is A. Glyburide. Glyburide is cleared by the kidneys and poses a higher risk of hypoglycemia in patients with kidney disease. Glipizide, safer in renal impairment as it is metabolized by the liver. Tolbutamide, not as commonly used, but safer than glyburide in this context. Glympyride, a third-generation sulfonylurea with less reliance on kidney function. Question 9. What dietary advice is essential for patients taking sulfonylureas? The correct answer is B. Never skip meals. Since sulfonylureas stimulate insulin secretion, skipping meals can result in hypoglycemia. Avoid high-protein meals. Protein does not directly interfere with sulfonylureas. Limit fat intake. While good for overall health, this isn't specific to sulfonylureas. Increase fiber intake. Beneficial for glycemic control, but not directly related to sulfonylurea safety. Question 10. Which sulfonylurea is considered the most potent? The correct answer is C, glympyride. It is a third-generation sulfonylurea with high potency and a lower risk of hypoglycemia compared to earlier generations. Tolbutamide, a first-generation drug with lower potency. Glipizide, potent, but less so compared to glympyride. Chlorpropamide, a first-generation sulfonylurea with prolonged action but lower potency. That's a wrap for today's quiz on sulfonylureas. How did you do? Let me know in the comments below. If you enjoyed this, don't forget to like, share, and subscribe to Drugs Decode for more pharmacology content.